Pastoralist communities have their own specific needs or challenges. The women have to fetch water, they have to look for food, they have to look for firewood, and the health facilities are far apart. And therefore, to access maternal and child health, they need to walk long distances.
Are roba chalungezi ngale kinta atamarngezi are chedano ingareni ngakipiji kina rangezi e kota jikaya unteni deke talate deke anakopit ngakipi korie school la tone yene ke ekide kune tengdanya poto hotel yakure ay alarte telo chirnya nyugu akamatari ngida atama ko gitone megni anakure ay ama mungipi megna ri ko la cher apeitanit.
Turkana suffers from hygiene sanitation related problems like cholera, polio and diarrheal diseases. The most affected is actually the mother and the child.
Mamberni anyameni aberu anta kara ina keporo. Telepuna abachi ngakile tamata beru. Ayen robachi ayeni atamare yelo chen kotere. Mamuro boy berni aleme. Be kana bona ina kenet. Eze kana tu bona rek. Be eze kana chapel ena kene. Mamuro ba kimeta na alem ni ayina. Ayina roba eze kana bon. Eze kana bon na bona kanyem tori akoro. Elilin yetawunde. Kugoro ko kwala.
Out of this district, which is 16,000 square kilometers, I only have 34 dispensaries. The distance from one facility to another is 50 kilometers. You need to walk, trek 50 kilometers. For a mother who is bleeding, either in pregnancy or after pregnancy, to make that mother walk 50 kilometers, I think it's a punishment in itself. But those are the realities we are facing this side.
Na la pole sukuwa. Atanya beralo kopakanin. Edounya. Aneru merta torotok singakot. Aya kerdak dongai ko ginin tanga peteni amata gua tanga peteni ya ko gine tani ada kia ani boche ni ananya tamar ko gine tanai ya tanai wa zegini ta tia ka boche aku tamara ro ko rike tia lakini ko ngichan lu ko ke ya kare tanga por bo rotar ani are ko lotar ya sebentar deh bala ke ye itu ani ni han ro bo tia ka kona ngaya torotok suro bangati ngate ngakot kucha daun yete ana uye atokana ya kara kurelo gerilo atokana loko boy robota ma ko gini kaleni peye tangedeni.
Reproductive and child health is not an issue of the woman. We need a lot of male participation. So when the man leaves with the cattle to look for water or for pasture, then the woman is left to do everything. And therefore, first of all, they do not have time. It's even worse now because they do both the chores for the women and also for the men.
Out of all the women who get pregnant, only 8.2% of them come to the hospital to deliver. The rest of them, they deliver at home. And they use the traditional birth attendants, which we as government we are trying to discourage them because we want to use these traditional birth attendants as conduits to the next level of these people being assisted.
Akan nagneter bang tunga lu arezi. Akan nagneter bo. Lemu tu nyemeyak. Atu buatara. Beringat muan tane kurokon dangang long. Seduro buaca.
It's very important to have a mother delivered by a skilled attendant in that every pregnancy is a risk. A skilled worker is either a nurse, a clinical officer, or a doctor.
We are marrying over young girls as young as 16, as young as 15 to these old men, and they are forced to become teenage mothers. Teenage mothers, their pelvis is not yet developed. The outcome is this, obstructed labors, and obstructed labor is one of the causes of maternal deaths, the 5 commonest causes.
In Turkana, when we talk about malnutrition, there is the malnutrition that affects children below 5 years, which is more common, but we also have adults, especially the pregnant and the lactating mothers, who are affected by the same.
The causes of malnutrition in Turkana is one, there is food insecurity, because for a long time in Turkana there have been no rain, and if the rain comes, it's only sparsely distributed, so people don't plant anything here. Women in a year, they don't take care of their children according to the nutrition standards. If you tell them, if you sell one goat, you can buy one sack of maize and some beans. They tell you it's better I have my animals, but I don't have the maize.
Pastoralist communities are still the ones that you'll find the immunization coverage being low. They need access to vaccinations, but they also need to be free to take their children for vaccination.
Mamula lo tolu peleng roba chai dokana gnete ngede kamate na kutuk ngedi roba la tokana ana cara. Mamulu ngerto. Area de betarang ngaragno na apolon.
And although the government has been doing outreaches, I do not think we have done enough, in that we need more resources in those areas so that we can reach every child with immunization.
There was one case confirmed in Lokichokyo. Then eventually, as the campaigns were going on and so on, 18 cases were confirmed. For one case which is confirmed or which has shown the signs and symptoms, then for each case there are about 200 in circulation, but they are asymptomatic.
If you need to intervene on issues of maternal child health in a pastoralist setup, it calls for a total reorientation and a total paradigm shift in the approach and the programming that you're going to institute. The traditional health facilities, static health facilities we had, they cannot work because today these people, they're here, tomorrow they're out. After 3 days, they are completely out of the radar and possibly cross the border to either Sudan, Uganda, or even Ethiopia. So we need a programming that is actually moving with their lifestyle as opposed to the other way around.
The issue of health in pastoral communities is not an issue of just health. Government has to work as a whole in various ministries, and partners have to work together. So we cannot as health think health without thinking other ministries.
Yeah.